right, and it looks like it's time to get started. Thank you so much to everyone for joining us. This is our first webinar in this series, and this is a part of the American Indian and Alaska Native Mental Health Technology Transfer Center. And today we're just going to do an introduction of that program and introduce you to the people who are involved. This is a part of this training series is going to be a series. We're planning to have one webinar each month on the topic of mental health in the American Indian and Alaska Native communities. And this is brought to you by the National American Indian and Alaska Native Mental Health Technology Transfer Center. We are part of the MHTTC network, which also includes 10 regional centers and a network coordinating office. Our center is a NAIAN certified educational provider, and we'd be happy to provide you with CEUs for a $15 fee. The CEU request form is available for download in the Files pod in the webinar screen, and I'll also be sending this form out in a follow-up email to all who attended. Immediately following today's webinar, you will be redirected to our GIPRA evaluation. SAMHSA asks us to evaluate our events in order to provide improved performance assessment and accountability. And this survey asks about your satisfaction with the event and will take less than 10 minutes to complete. We thank you in advance for helping us to improve our programs. You will be muted for the duration of this webinar, so please use the chat pod to share your questions and comments, and we will address questions at appropriate points during the presentation. So today's webinar will be presented by Dr. Annalena Skinstad, who is Clinical Professor of Community and Behavioral Health at the University of Iowa, as well as Megan Dotson, who is the Program Manager for the American Indian and Alaska Native Mental Health TTC, and Natasha Peterson, Program Manager for the American Indian and Alaska Native Mental Health TTC Supplement. And so I'm going to pull up their slides here a moment and pass things over to them. Welcome, Annalena and Megan and Natasha, and thanks so much for being here.
Thank you very much, Kate, for introducing us. I did want Sean to be part of this, so he's also going to be partly presenting for us. So thank you very much, and welcome to this first Mental Health TTC webinar for the Native American community. Here you are. This is the three members of our staff that have worked together since 2012. It's myself on top, co-director is Sean Baer, and Kate Trems, our web and communications director, is at the bottom of the picture, and you have already heard her voice. Our new staff is the manager, Megan Dotson, of the main Mental Health Technology Transfer Center, and we have a Tom Romano, a graduate student working with us. And the school supplement we often refer to is directed by Natasha Peterson. And as you know, whenever we are presenting any webinar or seminar, we want to acknowledge our funder. So the content of this publication does not necessarily reflect the views or policy of SAMHSA or HHS.
Hello, everyone. We just wanted to introduce ourselves really quickly. My name is Natasha Peterson. Like Annalena said, I am the program manager for the School Supplement Mental Health Grant. I have a background in public health and communications, with experience abroad working with nonprofits and at diverse communities, and I have a passion for behavioral health. I've worked with youth in a variety of settings, and as a volunteer manager and a program manager. I'm also from Seattle, Washington, but I now call Iowa home.
And my name is Megan Dotson. I'm the program manager, as you heard, for the Maine Mental Health Grant. I was actually born and raised here in Iowa in a rural community and graduated from the University of Iowa many years ago with a degree in sociology. I've been employed with the university now for about the past 16 years as a program coordinator working on several federally funded NIH projects in the colleges of medicine, nursing, and public health. During these research opportunities, I was able to work with a variety of communities and populations, including older adults, high-risk adolescents and their families in the area of substance use and mental health, and with individuals involved in the criminal justice system. I'm excited to be with the Department of Community and Behavioral Health working in the area of mental health again and hope to share my many experiences with this program.
Okay, I'm Sean Bear. I'm the co-director. I am a Meskwaki member from Tama, Iowa. I have a background in substance abuse, youth, behavioral youth, IEP, and veterans.
So we just wanted to go over our presentation plan for today. We'll start off with some introductions, which we already began with, as well as the history of our center. We'll then go into the MHTTC network on a national level, and then go more specifically into the center here at the University of Iowa. We'll talk about some of our current projects and follow with our contact details.
So the Addiction Technology Transfer Center is our longest standing center. We functioned under this title for the past 6 years, and then some. 2 of our staff members manage this center currently, and those 2 members are Jeffrey Ladolter and Steve Steiny. Steve just joined us recently this week. They will be working in tandem covering the main grant and the Tribal Opioid Response Grant.
And the Addiction Technology Transfer Center is one of the 3 separate centers we have at the University of Iowa. They're all connected. As you can see, we are all housed at the University of Iowa, and as you'll see in this presentation, they have 3 distinct logos which represent which SAMHSA network they fall under. So the second center that we have, which is our newest center at the University of Iowa, is the National American Indian and Alaska Native Prevention Technology Transfer Center. Cindy Sago is our program manager for this grant. But as you can imagine, many of our projects will span the 3 centers and require support and expertise from 2, if not all 3 of the centers.
So in addition to our 3 centers, we have 2 major ongoing projects. Monica Dreyer Rossi will be managing the Leadership Academy, as well as the Native Colleges and Universities Initiative.
And the Leadership Academy is something we have offered through the National American Indian and Alaska Native for 6 years. But before that, we have offered Leadership Institute since 2002. So with that, we have a picture here of the last cohort, and I just want you to know that we are starting the recruitment for the Leadership Academy, but we'll be recruiting also from people who are working in mental health as well as prevention.
So at the American Indian Alaska Native TTC, we have an established advisory council, which has been cultivated over a decade, comprised of behavioral health professionals, MDs, educators, and evaluators. This group of individuals ensures that the materials and curriculum we distribute are culturally informed and relevant to the populations we serve. They offer advice and direction, as well as integral knowledge from all regions of the United States, including Alaska, and allow us to properly serve such a diverse population. Our 90% Native Active Advisory Council is crucial to our success as a center. We value them very highly. And this is a picture from our most recent meeting all together in November.
So the National American Indian and Alaska Native ATTC started working with American tribal communities in the upper Midwest in the 1998 year while we were a regional center called Prairie Lands ATTC. At this time, 4 centers of excellence were created, which focused on areas such as things that are still important to our center, and these include substance use in women, substance use in clients with co-occurring mental health disorders, substance use disorders in clients who identify as LGBTQ, and substance use disorders in Native American clients and communities. Dwayne Mackey from the Santee Sioux tribal member was the coordinator of our effort in the Upper Plains region until he passed away in 2010. The Dr. Mackey lectureship was first offered in 2011, and in 2001 we added problem gambling to the center as one of our areas of expertise. So as of 2018, we now have the 3 centers all housed at our offices at the University of Iowa College of Public Health, the MHTTC, the ATTC, and the PTTC. We wanted to take a moment to recognize the Meskwaki Tribe, as we have several members of our team that are Meskwaki tribal members. So here in Iowa City, we're located about 77 miles east of Meskwaki Settlement that is located in Tama, Iowa. The Meskwaki Tribe is the only federally recognized tribe in Iowa, and we continually strive to use tribal lands for events and hold as many times as possible, no matter where we are in the United States. And since we have Sean here, we're going to let him speak to this for just a moment.
Okay, so this is just kind of one example from the different tribes that we work with, but we work with tribes all across the United States. Of course, there are differences within many tribes, looking at customs, beliefs, practices. They're going to be very different. Language can be very different, as we're looking from the language base that many of the tribes come from. So, looking at Algonquin, Siouan tribes, Athabascan, many of the tribal family languages that they come from.
And one of the things that we are specifically focused on when it comes to mental health issues, of course, also substance use, is historical trauma. And historical trauma may be different from tribal communities and regions to regions, but the essence is the trauma that affects people's lives. And that's going to be a very important part of this grant.
Yeah, so including that, we need to look at trauma and then remembering about PTSD. But looking from trauma, PTSD, historical trauma, we need to look at it more from a compounded perspective, because as we're looking at this, there are many factors that come into play when we're with clients. So including that is to remember trauma-informed care.
So we wanted to take a few moments to explain the MHTTC network on the national stage. We know when we first started working at the center, it was a little bit confusing sometimes. SAMHSA's family tree can be a little bit complicated, but we wanted to further explain how we fit into this family tree. So as you know, the National American Indian and Alaska Native Mental Health Technology Transfer Center is supported by SAMHSA and the Center for Mental Health Services. We have a map here which shows the network. We have one Mental Health Technology Transfer Center National Coordinating Office, which is located in Stanford. We have 10 MHTTC regional centers, one MHTTC Hispanic and Latino Center, and one Tribal Affairs Center, which is what we are. So you'll see that the 2 national centers are population-based, and then the 10 regional centers are located throughout the country. So we'll now move on to discuss more of the specifics of the National American Indian and Alaska Native MHTTC, here at the University of Iowa.
Okay, so our role here at the Native MHTTC, what is it? Well, let me tell you. Our role is to work with organizations and treatment practitioners who deliver mental health services to American Indian and Alaska Native individuals, families, tribal and urban Indian communities to strengthen their capacity to deliver effective evidence-based practices to individuals, specifically in the areas of mental health prevention, treatment, and recovery support. We also collaborate with our Leadership Academy program to encourage Native individuals to seek out career opportunities in the field of mental health by encouraging them to enroll in programs that will lead to degrees in counseling, human service education, addiction, school and community service managers, etc. So next I'm going to talk about how the MHTTC here at the University of Iowa is funded by two separate grants. So first we'll discuss the main grant, which is the one that I'm managing. We have three main goals for the main MHTTC grant. And these are first to foster regional and national alliances, as well as bi-directional informed communication among culturally diverse practitioners, researchers, policy makers, stakeholders, family members, consumers of mental health promotion and treatment services. The second is to enhance the existing training and technical assistance infrastructure to support programs and workforces serving tribal and urban Indian communities. 1 second.
Can everyone still hear us? Sorry, it looks like we're having some problems with audio. Okay, we'll keep going. If there's any other problems, just let us know.
Okay, I'm right in front of the microphone. I hope you guys can hear me. Kate?
Yeah, sorry, everything sounds good on our end, and so if listeners are experiencing some breaking up, it may be either your internet connection, or if you're calling in on the phone, it might be where you are. But from our end, we are getting good audio, so thanks for checking in on that.
Thank you. Thanks, Kate. So back to the infrastructure. This will allow us to facilitate the expansion of culturally informed knowledge and skills for effective mental health services to American Indian and Alaska Native populations, and to prepare for culturally informed evidence-based implementation. Third, we like to accelerate the adoption, implementation, and sustainment of mental health related trauma-informed and culturally informed evidence-based practices throughout tribal and urban Indian communities.
So the second grant that we have here is the School Supplement Grant. And we wanted to talk about some of the goals for this grant as well. So the first is to support the expansion of allowable activities for school-age children who experience adverse childhood experiences that contribute to mental health problems. So this could include violence in and outside of the home, trauma, and abuse. The second is to provide training and technical assistance on culturally relevant school-based and culturally based mental health services. And this would allow for enhanced capacity amongst teachers and counselors for future school-based mental health services. And the third is to create and distribute culturally adapted school-based mental health curriculum. And we know that there have been some efforts made, but we would love to collaborate with more people to work towards this third goal. So the services we will be providing are varied, and we wanted to give you some examples of our current projects that would give you a better idea of what we can provide and what we would be able to collaborate with you on. So throughout this grant cycle, we will be providing needs assessments and environmental scans and gap analysis for states and tribal entities, no-cost training and technical assistance via face-to-face meetings, webinars, conference calls, other virtual means of delivery to the mental health field, training and technical assistance, capacity building, and development of learning communities to urban Indian and tribes in American Indian and Alaska Native communities, as well as mental health newsletter and webinars that we'll be hosting every month.
I would like to add something to this, because an overriding goal for our center is to increase capacity of our colleagues out in different tribal communities. So we are very interested in developing training of trainers opportunity so that people who would like to work with us and train in their community, their colleagues, we would very much like to hear from you, and we would start working with this and with you as soon as we can.
We'll be providing our contact information at the end of this presentation. So we will also be providing education, training for certification exams, and clinical supervision opportunities for mental health professionals working with tribal members. We've mentioned the Native Leadership Academy throughout this presentation, and that's something that we'll be working on with Monica as well. And this is to enhance leadership skills in mental health promotion, treatment, and recovery. The expansion of telebehavioral services to urban Indian and tribal communities. Tribal action planning, technical assistance and ongoing support, and network-wide training and technical assistance. And that is just to promote the adoption and bidirectional diffusion of culturally informed evidence-based practices. And this would include trauma-focused evidence-based practices, suicide evidence-based practices, and we'll be providing training and technical assistance for recovery-oriented systems of care and other topics of interest. And this also includes the education of how cultural practices work as preventative factors.
So this is an example of an event that we have coming up, and Sean and I can talk about this. I'm going to let him speak first to what we're going to plan for February.
Thank you, Meg. Yeah, so in February 6th to 8th, we'll be having a Native Veterans event, which is a Native Veterans curriculum pilot. This will include Native veterans from across the country, which will, part of this, the beginning will be an overview of the history of Natives in the military, and then going on to trauma, PTSD, historical trauma, assessment and treatment, cultural models and considerations that may be added into it. And then also some of that also includes family, peer support, peer recovery. And then the final part is healing the healer, which is part of to assist those who may have difficulties with secondary trauma.
Sean has worked very hard on this curriculum because we are aware that Native returning veterans have a higher prevalence of PTSD than any other subgroups of veterans. And a lot of the veterans will not be treated in the VA. And some VAs are able to know what to do and how to treat Native veterans, others may not. So it's our goal to be able to provide a training opportunity and better prepare our colleagues to treat and work with Native veterans in a respectful and positive way.
So yes, this is a pilot program that we're going to be implementing here, and we have some evaluators coming in to see how this goes. So wish us luck on that. Now we're going to move on to another event.
So this is an example of a symposium that we had in November. It's a behavioral health symposium that we held here at the College of Public Health at the University of Iowa. Topics included how Native nations could reclaim wellness, holistic wellness, and how we can better integrate behavioral health and physical health. And this was sandwiched between 2 advisory council meetings, and so we were able to come together and host a variety of speakers from all over the country, Native speakers that helped give a perspective on behavioral health in the Native community.
And we have offered symposia before. The last one we did was in 2015, where we focused on historical trauma. And every time we create a symposium, we also develop the presentations into proceedings document. This symposium is, I think, available as a proceedings document on our webpage, but it's also going into second print. We have another symposium document that is actually very relevant at the moment, and that is when we worked together with Indian Health Service and Region 5 and provided a symposium on the opiate prescription challenges that we experienced in the early 2013s, 14s. And what we did with that was also something we very often like to do, and that is to enhance the tribal initiatives that are very positive. So based on this symposium, tribal members, I think there were law enforcement, pharmacy, MDs in different tribal communities across the upper Midwest, developed their specific project on how to deal with the prescription drug abuse issue. And to give you one example, developing a system to how do we dispose of painkillers, because at that point the focus of our concern was not so much the heroin addiction as it is now, but it was the fact that adolescents were initiated to use opiates based on what they found in their parents' medicine cabinet. We have other older proceedings document, but we are always trying to make sure that people have access to these presentations after the presentation and the symposium is over.
So we currently are housed on the ATTC, Santa's ATTC website. We will be having a MHTTC website going live in February. And we have more information updates to come. Like we've alluded to, this MHTTC network is brand new. And so there have been a lot of changes and updates. And so we will keep you posted on more information about that. And our next MHTTC webinar will take place on February the 13th.
We also do have a newsletter coming out, I believe, quarterly that we're working on right now with some collaborators. So be looking for that sometime soon.
And this newsletter will focus on issues relevant for mental health. And especially we have identified that in healing to wellness courts, generally people are not systematically assessing for mental health and even substance abuse. So one of our goals with this is to increase people in tribal communities and providers their ability to collect data, to gather data, and to be able to follow up their patients more regularly. This is also important when it comes to future grant applications, because people these days, when applying for grants, you really have to show through data that there is a need. And we are trying to support tribal communities in bettering their procedures when it comes to this. That being said, what we also know is that some of our tribal colleagues have a hard time applying for grants, not just because they don't know how to write it, because that's not the issue, but there isn't enough data to back it up. And we are going to very shortly initiate a project where tribal communities will be given grant writing experiences, support, how to prepare for a grant, how to maintain it, and how to make sure that whatever you initiate when you have a grant, you follow up after the grant period is over. So it's a very important project that we want to initiate sometime this spring.
So here is our contact information. You'll find Megan, myself, Sean, and Anna Helena. Like we mentioned before, Megan is the program manager for the main mental health grant, and I am the manager for the school supplement grant. And then we have our co-director and director. We wanted to open it up for questions that you all might have. If you wanted to just use that chat box there, we'd love to answer any of your questions at this time.
I see one of the questions is, would this PowerPoint be available for you after the presentation? And the answer is yes. We have a very limited preliminary web page, so I'm not sure when it will be up, but it will be up at one point when the web page go live. Do you know when it is for sure?
They just said February, sometime in February. So it's coming.
Yeah, and as Kate is saying, handouts are available in the files pod below, and will be emailed out to all of the attendees today. In the text box, you will find a link from Kate that is for the proceedings document for our symposium that was held in 2015.
Mm-hmm.
And we have a couple questions coming in. One from Andrew. Will there be a specific process to request TA?
What I think is important with this, we haven't developed a very extensive bureaucratic process. The way you do this is you will write to any of us and we will respond to your question and include people that we think would be important to work with. We are creating TA teams. Depending on what kind of topic for TA you are requesting, we would be initiating contact with our TA teams depending on what the question is.
And Leslie, the proceedings document, the link to the proceedings document is found in that text chat box starting ATTCnetwork.org, and you can access the proceedings document that was created from the symposium held in 2015.
And I also see there is a question, is there a way to send a link to the recording of the webinar? And what I'd like to say is that we have a YouTube channel that we sometimes post our webinars onto too. What I'd like to say is that these centers are so new and the web pages are so preliminary that it is sometimes difficult to use even the old ATTC link. So be a little patient with us, and we will make sure that you get a link to this.
And as you can see in the chat box there, Kate has answered that we do post our webinars, and a link to this recording will be emailed to everyone who is registered.
And one thing that I really would like to say as well, when we have these webinars, we really also want to hear from you. Are there specific topics that you think we should cover? Because a lot of the topics we have developed for our behavioral health webinar series, and this one will be part of it, is based on what people have asked us to present on. And we have a very extensive network of presenters and collaborators, the majority of them being native, will be presenting at these webinars that we have. And likewise, the TA teams are almost exclusively native professionals working with us.
So yes, if there's any topic you would like us to cover in a specific webinar, please let us know, and we would love to present those for you.
I can see that trauma-informed care is very important to Marcita, and I totally agree with that. And we will make sure that we cover that topic fairly early. And Sean will, of course, cover that topic through his new and pilot with the VA project. It's going to be a better name, but that's what our working title is at the moment.
We are also always looking for collaborators, and so please reach out to us if you would like to do so. All of our staff members are new, with the exception of Anna Helena, Sean, and Kate, and so please bear with us as we are learning this process along with you, but we would love to collaborate with Native communities throughout the United States. Marcita, we can answer that question for you.
Sean can answer that question.
Which is there a culturally relevant curriculum developed?
We have the South Dakota Native American curriculum. It has approximately 19 modules, which is actually adapted to the South Dakota tribes, the tribes in Minnesota, and we are working on some in the Southwest, and hopefully get some people to start working on that in the Wisconsin area right now.
And one thing that I want to say is that curriculum is very tested out. However, we do need to develop a specific couple of modules only on mental health, because we need to familiarize all our tribal communities about the evidence-based, experience-based, knowledge-based mental health practices that we know exist across the country. So that would be additional to the curriculum that Sean is referring to. I also want to add that we have plans to develop that also into a curriculum for teachers and counselors in schools, because we know that very many kids in Native communities and also in urban Indian communities are taught by non-natives with almost nothing of knowledge about how to understand and work with Native kids.
Yes, and the way the original curriculum, the Native American curriculum, was developed by, we worked with some people and with Dwayne Mackey. We got some more people together in South Dakota to put the Native curriculum together.
And I see that somebody thinks we have adapted that. No, we have not. Dr. Mackey developed this from scratch and got the award of the most innovative workforce development program from the Annapolis Coalition in 2006. So it's a curriculum that is connected to the ATTC and that we work on to adapt to the tribes we're working on in whatever region we are at that time.
Yes, and later that was adapted to the Minnesota tribes.
Yes. I am so happy that you have so many questions. And we may not have all the answers to you at this point because we are 3 months old and getting up to speed with a lot of things. But we look forward to working with you, and I really hope you give us suggestions, feedback, and reach out to collaborate with us. Because one of the things that I think is very important and is our main approach to things. We know that there are a lot of challenges in Indian country. However, we also know that Indian country is very resilient and has a lot of strengths, and we want to focus on strengths rather than deficits. So that's one of sort of our overreaching attitude to whatever we do.
And before we go, to answer your question, Marcita, about trauma-informed care, we do not have a curriculum developed, but we do have some presentations developed on trauma-informed care. And that's something that we'll be working towards as well.
Yeah, and it needs to be put together. So that's one of those projects we have in progress.
We have a question from Catherine. Once it's put together, will it become available through another webinar or another format?
It most likely will be another format. I think we often start our programs by giving you a teaser through a webinar, and then we will develop a more consistent and comprehensive curriculum. What we're looking for is anybody of you on the line who might be interested in training with us, and you will get access to some of these curricula when you are working with us and trained by us. We're very, very particular about making sure that people train our programs with fidelity. So that means we want to offer TOTs and work with you, and specifically on trauma-informed care, because trauma-informed care is really very, very emotional for most of us to train, and especially if you have been exposed to a trauma yourself, and being prepared for questions and being able to sort emotional versus more intellectual ways of thinking about this trauma is very important for anybody we work with. So that is both for support of our trainers, but protection of the trainer as well. And one thing that I also want to highlight and And that is connected to trauma-informed care. Having been a therapist for very many years and worked specifically on trauma, I know that it's very exhausting, it's very emotionally draining. And I know Sean and I have worked on burnout, compassion fatigue. That's a topic that we want to include as well. But one thing that I want to throw out to all of you, and that is, I am at this point concerned about how limited access there is in Indian country for clinical supervision. And this is especially important when you work with people with trauma, because you need different perspective, you need support, alternative ways of handling a problem. So we are really going to push, how do you, as tribal providers, make sure that your staff has clinical supervision and support, and also that there are money in the budget. I know in this time and day, talking about money in the budget when the federal government is closed is not a very good topic. But I'm still going to say it. It's very important for you going forward to think about how can you make sure that you are able to provide clinical supervision to your staff who are working with clients who've experienced trauma.
So we'll wait for a couple more questions to come in here.
I am so happy to see that someone is billing for reimbursement for insurance based on supervision. What I can say is that that's the minority of the organizations we are working with. And we do know something. The data is very, very clear. If an institution is able to provide clinical support, clinical supervision to their staff members, there is less turnover. And we know that turnover and recruitment and retention into behavioral health is a real challenge. So that's also our focus on this in this center, to support tribal communities in enhancing their ability to retain staff.
Yes, and sometimes if you look at turnover, you can look at that as a symptom of something else that might be going on. Mm-hmm.
We have still more time, so if you have more questions, please don't hesitate to send them our way, because we really look forward to working with you in the future. And we have our contact information up, so please don't hesitate to send us emails. A good piece of advice: if you send anything to Sean or me, please CC Natasha or Megan, because you most likely will get a quicker response from them than from the two of us. Sorry, Sean. And as you can hear, we are a team that loves working with each other. And that means we can pull each other's legs too. And we just pulled Sean's. That doesn't mean I'm spared. So we will wait a couple of more minutes and then we will end the webinar.
Are there any questions or comments or anything?
Well, thank you very much for joining us today. We're excited to work with you all. Please don't forget to fill out those GIPRA evaluations following this webinar.
And we will send the baton off to Kate.
Great, thanks so much, and I'll close this out here, and hopefully you'll be redirected to the evaluation. But if you don't get directed there, just watch for the email we'll be sending out, and we'll have a link to it there as well. So thanks so much to everybody, and hope you join us next month.